because there's an economic imperative moving in that direction. Hospitals. Hey, let me ask you a question. You know, some of you guys, you know, have probably cars that you love, and every once in a while it breaks down. You take if you don't do your own work on it, you take it into the shop. They fix it. Let's say that 3 weeks later the exact same thing broken. Your transmission's all messed up again. Now, if you went back to the car shop, you'd expect that they wouldn't charge you to fix what you thought you already paid for. But that's not how it works in medicine. In medicine, a hospital will take you. They are supposed to fix you up. 3 weeks later, you end up back in the hospital. They get paid all over again. And so part of what we can do is to say we're going to give a bonus to hospitals that lower the readmission rate, that try to get it right the first time. Those things turn out to be the biggest factors in why healthcare costs are going up faster and faster. Now, as I said, I'm still a believer in fixing the insurance system just so that we don't discourage doctors from going into certain occupations or certain specialties or in certain regions. But that, it turns out, is not the main driver of costs in the system. Okay? All right. So young lady's turn. Here you go, right here. And then I'll come back around this way. I know this group feels ignored here.
Thank you so much for being here, President Obama. It means so much to all of us.
Thank you.
I have Medicare and a good supplement, and I'm just happy as I can be. I never pay a cent for my medical care. But I think medical care is a human right that everybody in this world deserves. I wish, as I think you do,
I appreciate that.
that we had single payer like all other developed nations. I'm so glad that you're going to insist upon a government option, and we're trusting that you will hold tight to that. Thank you so much.
Well, thank you very much. And I do want to emphasize, you know, I've been talking a lot about costs lately because cost is important. If medical care just gets more and more expensive, then no matter, even if we decide to cover everybody under Medicare, for example, sooner or later we'd run out of money and then we'd be right back where we started. So we've got to control costs. But I don't want to lose sight of the personal element of this. I mean, I get letters every day. Some of you may know we get about 40,000 letters, I think, a day. I mean, we get a lot, letters and emails. My correspondence office, they choose 10 for me to read each day. And I'd say at least half of them have to do with health care. And you read some of these letters, and they're just heartbreaking. You know, you got parents who've got adult children who, you know, contract cancer, but the children are unemployed or don't have health insurance. And so the parents who were saving for their retirement, suddenly they've got to drain all their retirement savings to help keep their child alive. You've got people who had a small business and at a certain point just had to give up their business because they couldn't afford the health care premiums as a self-employed person, had to give up their dream. You know, people who are bankrupt. There was a woman in Wisconsin who I met who, she's 36 years old, had a double mastectomy. Now the cancer's traveled to her bones. She's got 2 kids. Her and her husband have jobs with health insurance, and they're still $50,000 in debt because of the care. And so she's fighting for her life, but she's worrying if, you know, she passes away that all she's leaving behind to her kids is hundreds of thousands of dollars worth of medical bills. That just doesn't make sense. We're the wealthiest country on earth. And for us to be the only advanced nation where everybody can't count on basic health care is shameful. And we've been talking about it for 45 years, 50 years. My attitude is that, you know, America is the greatest nation on earth. We can solve this problem. But we've got to put our minds to it, and we've got to overcome all the fear tactics and misinformation that's out there and just go ahead and fix it. So, all right. Gentleman's turn right here. This gentleman.
Right behind you.
Right here.
Thank you, Mr. President, for being here. My name is Jim Scaff. We just finished the 10th annual round in Wise County, and I tried every way in the world I could to get you down there because
the 10th annual
round. That's rural medical.
Oh, the RAM, absolutely.
Okay. This year again we broke all records. 2,700 people treated.
You guys did outstanding work, and people are able to get care because of the great volunteer efforts of people all over the country. That's great.
I felt like if you could have made it to RAM, and these people that have all these questions about whether we need health care or not, it wouldn't take them but a minute to see that we really need it now, really bad. And a follow-up question was, the people that you have Medicare now, why can't some people get on it?
Why can't people just get on Medicare now?
Yeah.
Well, that's the same question that this gentleman asked. And as I said before, well, there are some people who proposed in the past Medicare for all. That essentially is what's called a single-payer plan. And a lot of countries have single-payer plans. I have to tell you that politically it would have been difficult, and it would have been very disruptive, because what would have happened is a lot of companies who are currently providing care, their attitude would have been, you know what, if I can get government to pay for this instead of me, let me just drop coverage. So now suddenly a lot of people who currently would had coverage would find their coverage dropped. They would have to sign up for Medicare, and pretty soon you've got everybody on Medicare, but we don't have the tax base to pay for everybody being on Medicare. And so what we're trying to do is to build on the employer-based system that we already have. That has some disadvantages, I won't lie to you, but it's the system that people are accustomed to. And you know, if people are nervous, even when I tell them you won't have to change your health care and you don't have to be part of a government plan, then imagine how nervous they'd be if I said we're going to open up Medicare to everybody. Then, you know, we would really, I think people would just worry that they would lose their doctor, they'd lose their plan. But I still think the notion of having a public option that people can sign up for voluntarily is something that needs to be part of overall health care reform. Okay? Young lady right next to her. And I've just been alerted that unfortunately this is the last question. So you get the last word.
Hi, Mr. President. My name is Autumn Wells, and I'm an independent pharmacist from Big Stone. My question is, with this new health plan and opening up all this access to physicians, which is wonderful, with that, there'll be new prescriptions for patients, and how are they going to have access to the medications that they need to treat those medicines? And can you tell me, please, that it won't be as bad as this Part D plan has turned out to be for so many of my patients? They have great coverage for 3 months, and then they have no coverage for the rest of the year because they can't afford the out-of-pocket to meet the catastrophic.
Right. Well, first of all, I'm glad to know that there's still some independent pharmacists out here, because I know that you know, it used to be the pharmacist was one of the most trusted members of the healthcare system. Increasingly, you know, it's harder and harder to be an independent pharmacist because of the big you know, pharmacies operations that are out there.